Janice laid out, let me suggest the topics we would want to be sure that we covered today are, first of all, things you can do to prevent the spread of COVID-19 during the spring break. Across the street here, you can see that the Queens is setting up a screening clinic. Actually, it's a facility that's just been put up. That it is also similar facilities are going to be put up elsewhere in the state, and he'll describe a little bit more about what's being planned at all the, at least at many of the hospitals, to help us obtain more data on testing and to assure that the emergency rooms are not being overloaded as we go forward. And finally, Tim Sakahara is here to answer some questions about that you may have about cargo and other activities that are occurring. I saw before I came down here some pictures at Costco of the lines of people waiting to pick up supplies and goods, and of course people are worried about what might happen if we were to have a delay in shipping. So Tim can give you some words along that line and answer any questions you might have. But first, let me start by talking a little about. I want to start by talking a little bit about the headline in the paper today. Again, expressing concerns about the testing programs in Hawaii. The Department of Health started testing individuals with the test kits that were provided by the Centers for Disease Control, which included very specific and narrow guidelines on who we would test. That was individuals with severe illness who had exposure history to China. And in that situation that the flu had been rolled out. Since the test kits were first rolled out, the guidance has been extended to other countries, but the guidance still requires that we only test those with severe illness. These are the people who we need to test most. They're most likely to be exposed, but there are lots of other people out there that have less severe illness that are, of course, concerned. We recently implemented a screening program, basically a surveillance program to identify individuals who may not have been picked up in our initial testing program to see if the virus is circulating in communities here. And we're expecting results from that to come in very, very soon now. We have Dr. Sarah Park with us here too, and I think she will say a few words about the purpose of that program and how we're going to be using that information. But as Janice pointed out, the main reason for us getting together today was to talk about what we think people should be thinking about as we go into the spring break period. Department of Health is strongly recommending that individuals continue to pay attention to their hand washing, avoid individuals who are sick, and basically pay attention to your personal hygiene. It's all of us who are going to be responsible for preventing the spread of this disease. As I say that, we are looking at putting out guidance on large gatherings, on travel, and in other areas. Essentially, our guidance is to avoid large crowds and gatherings where people may be exposed to others who are carrying the virus. We're going to be working on defining exactly what large is, but I would suggest people use common sense going forward and not attend large events, sporting events or other events where you may come into contact with lots of other people. Again, we'll be working on getting out specific guidance to you all on that. Essential travel is still critical, of course, but I would strongly recommend that people avoid discretionary travel, trips to the mainland to go skiing. Other types of vacation travel would certainly fall into that class. There's a lot of activity occurring over the holidays that you'll not see because of this situation worldwide and, of course, throughout the U.S. But for those who are contemplating discretionary travel, I would certainly ask that they reconsider for lots of reasons. One being they may be stranded wherever they end up, and secondly, of course, they may be exposed to individuals who are carrying the virus. We still have no evidence of local transmission here. However, as we get more information on this situation, we may certainly find a case, and I certainly expect we will find a case where there hasn't been any travel history, where someone might have been exposed locally. So everyone should be very vigilant about protecting themselves, their families, and not to expose themselves unnecessarily to the virus that's causing COVID-19. With that, I'm going to ask, first of all, Hilton Raphael to describe to you what is happening at the hospitals. This is an initiative the hospitals took on, and we're very pleased that they have taken the steps they are to screen individuals for COVID-19. The requirements are very straightforward, and I'll have him describe those to you.
So I'm the President and CEO of the Healthcare Association of Hawaii, and we have been working with our members across the state to stand up screening and collection centers for COVID-19. We had a call last evening, for example, with every hospital in the state, public and private, Tripler, the state hospital, and to discuss all the plans to make sure that everyone's on the same page, that we have consistency in terms of our approach. As Dr. Anderson said, the Queen's Medical Center started yesterday testing, setting up a testing site for COVID-19 and for flu. So it's a separate site outside of their emergency room to act as a triage center. And today, Hawaii Pacific Health at their 4 facilities is standing up testing centers as well. So that's Straub, Kapilani Medical Center for Women and Children, Polimomi Medical Center, and Wilcox Memorial Hospital on Kauai. So they were all stood up as of today. On Monday of next week, other facilities are coming online as well. So there is a rollout over the next few days and week across the state of clinics, screening clinics for COVID-19. Now, these are not clinics where you can just walk up if you think you want to be screened. The clinics do require a physician order or physician directive. And what you can do if the members of the public think they have symptoms, or they've been exposed to someone who has symptoms, or if they've just come back from Washington State, for example, or some other area in the country where they might have been exposed, they can talk to a doctor. They can call up a doctor, their primary care physician. They can do a televideo call with the physician, and if they meet the criteria for screening, then they can then go to one of those centers and get testing. When I say testing, it's actually the collecting of the specimens, because the labs are doing the testing, and Dr. Anderson has talked about, and Dr. Park have talked about the actual testing. So these are actual specimen collection centers. So we are working with all our hospitals across the state, and we are working with urgent care centers as well. So there are a number of urgent care centers. There is one in Kaneohe, for example, that is already up and running. There are another organization that has 3 urgent care centers that is up and running as well. Just got off the phone a few minutes ago with the Maui medical group on Maui, and they are working to set up a testing center as well. Maui Memorial Hospital is collaborating with the mayor to set up a site, and there are sites also being set up on the Big Island as well. So they're not all up and running, but we are working together. We compiled a list of all the sites, which we've shared with Dr. Anderson and his team. We're working today to collect considerable amount of other details in terms of the hours that these sites will be open. Kaiser, for example, Kaiser is doing all of their clinics, doing screening. Tripler Army Medical Center at their clinics, they are doing screening as well. So there are many organizations across the state that either have the capability right now and are doing screening for COVID-19, or will in the next few days or week will have the capability to do screening. Thank you.
Let's pause for a moment. I wanted Dr. Park to have a chance to talk about the surveillance program, but if you have some questions on what we've just covered, this might be a good time to do that.
When it comes to screenings, because the public, they're calling in, they're emailing in, hey, we show up, and I know you said you got to get a physician, your primary care, to authorize you, I guess, to get the test. When you say screening, for instance, Queens 10 is set up, what's the difference between screening and getting tested? Is there a difference? Queens yesterday told us they're not ready to test.
That is correct. So right now the only two places in the state of Hawaii where the actual tests can be run for COVID-19 is the state lab and Triple Army Medical Center. But Queens, for example, has one of their subsidiaries is Diagnostic Laboratories, DLS. And DLS has an arrangement right now. DLS is not testing, does not have the capability in Hawaii to test for COVID-19 right now. However, they have a partnership with a mainland lab. And so the specimens are being collected at Queens, as in all of these other sites, and they are being then shipped. They're refrigerated and then shipped across to the mainland right now. So DLS and clinical labs are the two primary labs apart from the state lab and Tripler. And right now, clinical labs, any specimens that are collected by clinical labs or by any organization, any clinic, screening clinic that is given to clinical labs, are being shipped to Texas. There's approximate 3 to 4 day turnaround time right now. But both clinical labs and DLS and Kaiser are all working to have the capability to test on island. And the understanding is that once we're able to do that in the next 1 to 2 weeks, it'll be approximately a 24-hour turnaround time, as opposed to having to ship these labs, ship these specimens to the mainland to get the results back.
Okay, so in 1 to 2 weeks estimated, these places like Queens, Triage, or whatever you call that, Disaster 10, and Straub, I saw they set up one. People would be able to go there if they are referred by their primary care physician or someone else to go and get that test and get results back in 24 hours.
That is correct. That is absolutely correct. And that's what, so this is a phased approach. So we started with the state lab and Triple Army Medical Center. Now Tripler, being a DoD facility, is for military personnel and their families. But the state lab, so this is, as of the middle of this week, we now have DLS and clinical labs have that capability to collect the specimens, or to take the specimens from these collection centers, package them up, put them in the right appropriate containers, air freight them across to the mainland, and get them tested and get the results back. But then again, that turnaround time will be dramatically reduced when they're able to do the tests on site in Hawaii. And they're working very, very hard to be able to do the testing in Hawaii so that they can reduce that turnaround time and reduce the amount of time it takes between when you actually get the test done and when you get the results back.
And so the testing criteria for that is a lot lower than the state lab one?
It is because the physicians, these are community physicians, and again, one of the reasons we're working with all the hospitals and all the clinics is to standardize the protocols as much as possible. But there still would need to be some symptomology or exposure. But I'm not a clinician, but my understanding is it is a lower threshold than, you still need a physician's order or physician's directive, but you can get that by talking to them over the phone, by doing a televideo conference, by doing a walk-in. Now, some of the urgent care clinics, for example, they are actually doing a drive-up clinic, where if someone says, look, I have symptomology, or I believe I have exposure, that you just drive up, you will stay in your car. A clinical person in full protective, the appropriate protective equipment, PPE, eyes covered, mouth covered, and with gloves and a gown, will come out, and while you're sitting in your car, they will actually take the swab in your car. So the patient or the potential patient does not have to interact with other people who are in the clinic for other types of reasons apart from COVID-19.
Where is that happening?
That is happening at, right now, that is happening at I'm blanking on the name of the clinic, but there is a set of 3 clinics. One of the sites is in Honolulu. One is on Kailua. I've forgotten where the third one is. Where today they are doing that drive-up testing.
But again, Hilton, I think with that they still require that a physician
Yeah, that is correct.
Probably reinforce that.
Yes, just want to be clear that even if you drive up, you still have to meet the criteria because the physician still has to write the order. The good news is we've been working with all the plans as well, and as we've heard, all of the major plans, HMSA, Kaiser, United Healthcare, Aloha Care, all of the major plans in the state are waiving any co-pays or patient deductibles for the COVID-19 testing. So there is no out-of-pocket cost. For example, there's nothing, if you haven't met your deductible, you don't have to pay anything to get COVID-19 testing done, and there's no co-pays for the actual COVID-19 testing. Now, if someone were to require hospitalization or some other type of follow-up care, then normal co-pays and deductibles would apply. But for the actual testing itself, all of the plans in the state and the federal government and the state government want to ensure there are no barriers to actually getting the testing from a monetary perspective.
Representative Tulsi Gabbard pretty critical about testing in Hawaii. We talked to her a little bit ago, and she's basically saying it's too narrow here versus like somewhere like South Korea. Do you think that primary care physician meeting or that consult is ever going to go away, and somebody who is sick and wants to see if they have it could just drive up to one of these centers without that doctor recommendation?
At this point in time, all of the screening centers, and this was unanimous last evening when we talked to all the hospitals and as we talked to all the clinics. Now the barrier may be lower than what it has been, or the threshold may be lower, but you still has to be a reason. This is an invasive test. It's I don't think it's very pleasant. I haven't actually had it done, but my understanding is it's not very pleasant, so it is somewhat invasive. You are collecting bodily fluids. And I don't know that people want to do it just for the fun of it. So there has to be a reason. So just because someone is feeling a little under the weather or they had a really late night or whatever, that's not enough reason or rationale to say, look, well, let me get a test just to make a COVID-19 test. So again, there has to be some type of rational basis. And this is, the insurance companies are telling us this, the state government's telling us this, the federal government's telling us this, commercial plans, everyone's telling us this, the providers are telling us this. There has to be some rational basis for saying, yes, we want to expend the healthcare resources. But this, the screening that is going on is going to dramatically increase the availability of testing across the state of Hawaii.
I'm sort of watching our comments come in as this press conference is going on, and you said the 2-week time frame before we get the quick test results back. A lot of people are wondering what specifically do we need here, technology, equipment, to actually have those test results happen quickly within that 24 hours? Why is it taking 2 weeks? What do we need specifically?
I do not work, I'm not a biologist or anything like that. I don't know if Dr. Park or Dr. Anderson can better respond to that question.
I'm going to very quickly go on to Dr. Park here, but let me say a couple of things to augment what Hilton has outlined. Besides expanding our testing capabilities, one of the reasons why we're at the health department very excited about the opportunity for the screening is it's going to take a lot of pressure off the emergency rooms. The emergency rooms here are critically needed for people who need to go to emergency rooms. And right now they're getting slammed by individuals who want to be tested for COVID-19. That creates lots of problems. First of all, it's hard to deal with emergency room volume. Secondly, those in the emergency rooms have to protect themselves from the virus. They have to wear protective equipment, which is in short supply. So it's a very efficient way of screening individuals outside of the hospital where it should be done, so that the emergency rooms are available to take care of those who really need emergency care. As far as the testing process goes, our lab is able to turn over samples within a few hours. In fact, if we get a sample in the morning, we typically have results in the afternoon. And I expect the private labs, when they get the service going here, will be able to turn over results very quickly too. The reason it's taking 2 weeks now, maybe not 2 weeks, but at least several days to a week, is because the samples have to be shipped to the mainland. And then, of course, they have to be processed at mainland labs. Needless to say, labs all over the country are being stressed in just keeping up with the volumes there. So we'll be in a much better position in a week or so when our labs are able to provide that service locally. And with that, let me suggest that we can come back to some of these questions if you wouldn't mind. And I'd like to ask Dr. Park to talk a little bit about the surveillance program. So let me just be sure you all understand we've got 3 things going now. We've got our PUI testing that we're doing as we see serious cases identified in the community. We are, of course, continuing that process. We now have our surveillance program that's looking to see if the disease is being transmitted in our communities. And finally, the hospitals have stepped up and are screening patients who have less severe symptoms and are looking at individuals who may be infected that we might have missed through the initial surveillance. So, Dr. Park, if you would.
Yeah, I saw it. So, as has been said, we've been limited on the testing because of the FDA's requirement. The emergency use authorization for the test requires that we prioritize certain individuals, and primarily hospitalized individuals with a travel risk, a specific travel risk. And so, and even as that expanded, we're still primarily focused on severely ill individuals. So those of us who are epidemiologists in the department, we started discussing this issue of how do we look for other individuals, because we know with every disease there's a spectrum of that disease, but we're precluded by that test. So we started those discussions, and we reached out to CDC colleagues, even as we heard that they were potentially looking at standing up what they were calling sentinel surveillance sites. And I basically got them to agree. They've readily agreed that Hawaii, they identified Hawaii as a potential site of interest for nationally as far as a surveillance site. And so that was really great news, because that meant that they would be working to help us be able to get that special sort of recognition, if you will, to be able to use the test specifically for surveillance purposes, and surveillance meaning for mild to moderate illness, so that other spectrum of the disease that we were concerned about. So, fortunately, after many discussions, much planning, quite frankly, and preparing, we were finally able to launch this surveillance program this past week. Even before launching it this past week, we were able to actually start collecting, or actually identifying specimens from the previous week to be able to start including into our surveillance program. So, as has been mentioned by Dr. Anderson, those tests are starting to be run, and we're continuing that program. And as a reminder, because I know we've talked about this before, that surveillance program is predicated based on our previous or current flu surveillance program. So the way the flu surveillance program works is that we have sentinel providers across the state. In addition, we also get a list of all respiratory specimens that are submitted to clinical laboratories, our 2 major clinical laboratories in the state. And what our epidemiologists do is take a look at those specimens, and we pick at random the flu positive specimens to then send on for confirmatory testing and to review for further information. And that's how our flu surveillance system usually works, okay? And we transmit data from our sentinel providers to CDC, okay? That's our flu surveillance program. The way this system will work is using that same sort of format, except now we're pulling flu negative specimens. So essentially, it's still outpatient specimens, and we're primarily looking for those people who have not traveled. So it's indicated in their submission form that there's been no travel history. Then they've, because they're outpatients, we know they're mild to moderate illness. And so we're pulling these people, and we're also trying to make sure we pull across the age spectrum. So there's a lot of interest in terms of, who really is at risk. The data is showing it's primarily older individuals, it's primarily people with underlying illness. However, there's a remaining big question of what about the kids? We know the data is showing that they have mild illness, but the real question is, are they actually getting the disease? Are they actually a driver in the disease? We don't know that. CDC doesn't know that. And so we're hoping our data helps not just us in Hawaii, but also the nation, and helps CDC by contributing to that national sort of surveillance overall, to be able to provide better recommendations in terms of how to protect all of us. So that's really a lot of what we're doing right now, is to try and contribute not just to Hawaii's understanding, but the national and even the global understanding of this disease. And so we're really hopeful that as this continues, we'll gain a lot more data to help all of us. So
Before we go into the questions. Tim, are you still here?
Yeah.
There you are. I'm not for you. You're camouflaged. There's been a lot of concern about freight and cargo shipping and so forth raised recently, and Tim is the Department of Transportation is here to answer any questions you have, but perhaps can give you some reassuring words here.
Yeah, aloha everyone. You know, first and foremost, what I want to say is that all of the commercial harbors in this state are open, and all of the shipping and cargo companies continue to operate normally. Any reports out there stating otherwise are 100% inaccurate and false. So this is a very good reminder to everybody out there to get your information from your official sources, especially when something like this, right? Don't believe your uncle's roommate's girlfriend who happened to hear something on the other line, which may have happened in this case. We actually don't know where it originated from, but we want people to get their information from official sources. Social media can be a very good and valuable tool, but it could also be very damaging and have consequences. And so all day and all morning we have been trying to squash any of these rumors that the harbors are closing or shutting down. Just a little background as well. The harbor system is critically important to our existence here in Hawaii. Obviously, we live in an island. It's an island state. 80% of everything we consume in this state is imported, and of that, almost 99% of it comes through our harbor system. So you can see it's a critical piece of infrastructure in the system that impacts all of our daily lives. And right now, there are absolutely no plans to close the harbors, mainly for that reason, because of its critical importance. So again, we want to be able to ensure everyone that that is the case. All operations continue to be normal with the shipping and cargo companies, and we want people to keep that in mind before they make their next trip to Costco and things, because things like this can contribute to any of those hoarding cases that we have seen out in the community. So again, reminder to get all your information and details from official sources. Thank you very much.
With that, we'll open it for questions. Janice, I think you've got some materials, references up here. If people need more information on guidelines and so forth, you'll have it up here, and you can, of course, check out our websites. So we have a few minutes if you want to have any follow-up questions or wanted to speak to any of us about where we are.
So, Illinois schools, they closed their public schools. Is there any timeline as to what point DOH would recommend closing public schools here? And is there any plans in place that you guys know of in that realm?
We're not at a point yet where we're recommending closure of schools. Things are changing every day, and of course on the mainland, various school districts are closing. Los Angeles, for example, I believe closed their schools today, and other states, including Virginia and possibly others, are also doing the same. We are, however, recommending events be postponed or canceled at the schools, places where people would be gathering, and we do have some very specific guidance available for the schools. We are working closely with the Department of Education in developing guidelines, not only on travel, but also on activities and so forth related to school attendance. I don't foresee that in the near future, at least, we're going to be closing schools here. Obviously, if you close a school, you've got child care issues and other issues out there, and kids can get exposed as equally well in the mall or wherever they may end up. So there are lots of pros and cons associated with school closure that we're looking at and will continue to look at. But at this point in time, we're not contemplating closing any schools. Same time, we are recommending that people avoid large events, and that applies to school children as well. We don't want people to be traveling unnecessarily or to be going to places where they may be exposed to others who carry the virus.
Right, so my follow-up to that one would be, it's like prom season right now as well.
Yeah.
What point are we going to start seeing like these kinds of big school gathering events? Any recommendations on that as well?
There is very good guidance now being provided through the Department of Education on activities and events that are going to be canceled going forward. Typically all the large events and gatherings which we all have come to enjoy are probably going to be canceled for the near future.
Talk about graduation.
I'm talking about graduations and proms and all the other gatherings, at least for the next month or so. Part of the issue is, of course, how long is this going to last, and we may be lucky. It may pass us without a huge impact. I don't think that's going to be the case. What we're looking at in this situation is trying to assure that we're able to manage the cases that are likely to occur, so that we don't see an undue burden on our healthcare system, so that we can continue as best we can to continue life as we know it, and hopefully that won't result in extending the course of the outbreak more than it would otherwise happen. But I'm confident we're doing everything we can to identify any risks here and to mitigate those risks aggressively. We feel very strongly that we should be taking a preventive approach, anticipating what might happen, and taking action before we see significant problems occur. And some of these actions are going to be very uncomfortable, including those canceling of large events that we've all been looking forward to over the years. The Merry Monarch was canceled just recently, and I think you're going to see most major events in the state canceled just for concerns about this virus.
I mean, I know that you're saying that these events like prom or graduation, even maybe sporting events for school may be canceled, but how is that any different than school itself when you have, in some cases, Campbell, they have over 1,000 students there. That, I would say, is a large gathering where you have 30 to 40 kids in one classroom. How is that different from a public event where a large group of people are gathered?
Well, of course, if you go to a gym or any of these other school facilities, you have a lot more people together for sometimes extended periods of time. Sporting events are a classic example where you have people packed into a relatively small area and could be exposed to each other. The efforts are being made at the school now to be sure that everything that can be done is being done to clean surfaces and to avoid unnecessary risks in the schools. Again, this is a risk-benefit decision that you always need to make in these situations, and the benefits of having the children in the school actually are considerable, and the risks I think are manageable as long as we don't lose sight of the fact we need to avoid unnecessary transmission. This may change in weeks to come. Other school systems are seeing the situation develop to a point where they had to close schools. This is typically in areas where you have a lot of transmission of the disease in the communities those schools are in. So it's being managed differently in different areas, and even here, over time, we may come to the point where we're going to need to look at that issue. But I don't believe we're there yet.
For Dr. Park, community surveillance. Is that, and I know you talked all about it, I just wasn't keeping up with you. I was
That's
thinking
okay.
more like in Kaneohe, there's a place where you guys are surveilling, like an actual physical place. How does community surveillance work?
Yeah, so again, it's normally flu surveillance. We basically identify at random specimens from across the state, and they're tested, right? And we get information about those specimens. We get information also from the sentinel providers that are participating about how many patients they saw for that acute respiratory event versus how many total patients. And that's how we generate all that data that you might see in our weekly flu surveillance report. So the difference here is now we're trying to gather the same sort of data, but on people that have tested negative for flu. So we're collecting across the state again. We're looking at all those specimens that are being submitted on an everyday basis from any clinical provider's site. Could be a clinic, urgent care clinic, could be a private provider, could be even an ER or whatever, but all of these people are just walking in, walking out. They're not being hospitalized. And so those presumably are mild illness, right? Mild or moderate illness. They can be recuperating at home. And so that would be very valuable information for us, especially since right now a lot of what we're doing, we and other states have been doing, is prioritizing the hospitalized, the severely ill, because we've been being necessitated to do so by the constraints of the tests, as well as the fact that those are tending to be the ones that we have the most concerns about, right? And quite frankly, for those who are mildly ill at this point in time, while, if you have concerns, certainly seek help from your healthcare provider. I think we need to also be careful about the healthcare burden. You've heard comments now about the use of personal protective gear that's required of all healthcare providers when they see patients with a respiratory illness, and they have to protect themselves. And as a result, we're seeing what we're calling a burn rate, a huge burn rate of this protective gear. And so these clinics or these screening sites that are being set up by the hospitals are recommendations that if you're mild or have moderate illness and otherwise healthy, to stay home, is all to try and help our healthcare system from not basically collapsing from the fact that there's too many patients going in to see providers, and that those providers are not equipped then to see those patients. We need to make sure it's a reminder that this is going to be a marathon. And so we need to make sure our resources stretch, including our testing resources, by the way. The same issues around supplies for personal protective gear also apply to testing across the world. Those reagents, because it takes so long. There's requirements. These are not like a simple just do-it-yourself test kit. These are technical tests that require skilled, trained technicians. They need to prove that they can conduct the test. That might take about a week's time for them to validate that. Remember back when we were validating and we said it was going to take us maybe about a week, maybe less, maybe 2 weeks, we weren't sure. So now the clinical commercial labs have to go through that same process. So it's not as easy to sort of say, oh yeah, bring that test online in the state of Hawaii or in any place. So all of us in public health, healthcare, the community need to work together, and that's what we're doing. That's what all of this is all about.
On that, what is the status of that protective gear right now? You said, is it some places are running low, or?
Yeah, we're hearing, just like across the nation, we're also hearing here from our providers that they're also running low, some more than others. And again, a lot of the efforts that we're seeing by the hospitals is to try and help the providers, the single providers that are out there, so that they can have some place to direct the patients that they're worried about to get that testing if that's needed. And that they don't have to go through their own meager supplies, frankly, to be able to make sure that patient is tested. By the same token, just making sure that, or putting in people's mind the idea, understanding that these testing sites are for sick people, okay? And for good reason. And we don't want worried well or well people essentially to go to these sites, because if you think about it, that would be the worst place if you're well to go to this site, because there are going to be a lot of sick people there. And if you weren't infected before, you're going to expose yourself by going to these sites. So it's really supposed to be for the sick people. If you're well and worried, you can call 211 or call your provider and ask them questions. But please don't go to where the sick people are going to be, because that's just going to increase your chances that you will be infected.
Dr. Park, I think last time we heard from you, there was a lot of questions and lack of information about that Canadian physician that went back to Canada, tested positive. Any updates you've gotten on that?
At this time, we're still waiting for information from our Canadian colleagues. I have reached out through multiple contacts. I've been very creative in reaching out to anyone I know clinically as well as in the public health realm to get information. And at this point, I have gotten contact back that they said they're collecting data or whatever that means, but that I'm still waiting for that information from our Canadian colleagues, because I've asked them for confirmation to, because obviously we're all wondering how is it that it's being reported in media and they haven't reported it to us. Because normally there's an international agreements to have an international notification.
So you got zero new details on that. And did I hint some frustration there?
Yes. Yes.
Sorry, to go back to the schools thing, I just want to clarify. Is it the DOH's recommendation that these school functions are being canceled, like prom, graduation, and then other sporting events?
We're working with the Department of Education and looking at activities which we feel are high-risk activities that need to be canceled under the circumstances. In this, we haven't. The department hasn't put out specific recommendations yet on those types of events. The DOE has been looking at travel, and I believe they are also recommending the elimination of any discretionary travel. UH has also done the same, and we're continuing to look at the events and other activities at the schools and we'll be, I'm sure, coming out with additional recommendations as it relates to activities at the schools when schools resume. Of course, we're in a situation now where we've got spring break for a lot of the kids, and we really do want them to be aware of the situation and be careful about where they go and who they see. That was one of the reasons for having this meeting today, is to let people know. By the way, there's a lot of guidance in our press release you may want to use. We have, I think, time for one or two more questions. Yes?
Just real quickly, there's been close to 2,000 direct flights from Korea over the last 2 weeks. Are you confident that those people coming here from Korea are safe, been tested, or should be traveling to?
Yeah. Well, the travelers from China and Iran are all being put into mandatory, or I should say voluntary, quarantine. They're actually required to spend 14 days in self-quarantine. That's not true of the travelers from other parts of the world. They are being provided information as they come in and asked to monitor their own health, and of course call if they do have symptoms of illness. Those are travelers not only from Korea but also from Italy and most of Europe at this point. So virtually all international travelers are now being greeted and provided information similar to the information that we're providing to those who are coming from Korea. Across the world, I'm sure are aware that this disease is becoming a pandemic. It's causing illness in virtually every country in the world. Those that aren't reporting it probably just haven't looked for it. But in some places, particularly some of the European countries, they're seeing a healthcare crisis. We want to avoid that if we possibly can, and the proactive measures we're taking here are intended to do that.
With that, to avoid that healthcare crisis, it almost seems like there's an honor system with these travelers. Like, what's being done to make sure they are being in that self-quarantine? Is there a follow-up? Is there communication?
Yeah, for those who are in self-quarantine, they are monitored. We have public health oversight, which includes calling them. They're taking their temperatures twice a day. And by the way, we do check in on their whereabouts. We've gotten really good compliance. We find that having people be quarantined in their home or in a comfortable location makes a big difference. They're much more likely to be compliant in those situations. And so far, we've had no problems with people wandering out and potentially exposing others. I think people realize the significance of the problem.
Do you guys get like a list? Does DOH get a list from the CDC of these travelers? How do you even know they're here to begin with?
Yeah, those who I mentioned who are from those two countries, China and Iran, are met at the airport. The Customs and Border Patrol review their passports, and if they've been from those areas, they're referred to the Centers for Disease Control, who in turn pass the names on to us, and then we contact them and make sure that they are in a self-quarantine situation. And that has worked pretty well. For the other travelers, it's basically an honor system, trust system, that they're going to be monitoring their own health and of course reporting to us if they become ill. So far, we haven't had anyone become ill who, as far as we know, has been positive, but we'll have to see how that goes. Again, we're just at the beginning of this situation. It's like a tsunami coming to us, and we're trying to get ready for it as much as we can.
How many tests have been done as of this afternoon, and are there any positives?
The only two positives that we have are the positives that we've seen previously. We have 2 individuals under investigation today. Yesterday we had 5. The day before we had others. I expect this number will increase over time as more and more countries are experiencing this problem. Those who are being monitored will also increase, and I think it's just a matter of time, maybe even days, who knows, hours, until we get another positive. But I can assure you that we will be following up with those, identifying contacts, and of course informing them of their potential exposure. This is what most states are doing, and will continue as long as we have the resources to do it. In many states, they've almost given up. There's so many people out there and so many potential contacts. To try to identify all of them has been practically impossible. So what we're seeing across the country is efforts being focused more on these mitigation measures that we're talking about: avoiding crowds, stay at home, don't go to work when you're sick, limit your travel. That's what's really going to stop this disease from progressing rapidly. Chasing contacts and so forth is important, but I think we really need to step it up and focus more on these community prevention measures, and of course emphasize to everyone that they need to take an active role if we're going to stop the spread of the disease here in Hawaii.
So what is the actual number of the tests that have been done so far as of this afternoon? And those 2 people that you're currently looking at, are they different from the 5 yesterday? And
Yes.
if so, where are they? Which island?
We have two new ones today from the island of Kauai. They're one of a number of people who have been tested. I think to date, Sarah, we've tested 30 or 40 total?
40 or so.
Yeah, about 40. So again, we're focusing on the seriously ill who the physicians are seeing that meet the criteria that CDC has. And we'll be getting a lot more information over the next week, both from our surveillance program and from the private labs that are doing additional testing.
Sorry, really quick on this survey testing. I think back when we were thinking about it, we had mentioned that it might be difficult to notify people because of the randomness of the selection. Is that still a problem?
No, no.
No. So you
Well,
can't-
I guess it wouldn't. It's more about how quickly we can. So you have to remember these are laboratory submissions, and so we're dependent upon what's on those lab forms. So if those lab forms are filled out very completely, then it makes our job a lot easier to go back and identify who the individual is, rather than you see on the lab form just one physician's name, no number, and then we have to figure out where that physician is, call the physician, and it just takes a little bit longer, right? So that would be the determining factor in terms of how quickly we can get back to that individual. But obviously, every new positive that we find through the Sentinel program, we're going to be, contacting those individuals for obvious reasons and trying to get more information about those individuals. And the data, as I said, is going to be transmitted to CDC. Not the identifying data, obviously, but things like they want to know about age. We do too. Age group. What the circumstances, what potential epidemiological risk factors, what the clinical presentation. These are all really important information that is going to be useful, again, for Hawaii as well as the nation. So, I mean, it's pretty exciting stuff, frankly, from our standpoint. We're really happy to be able to do this. It also means that we'll have a broader look at our community and across the state, and again, from looking at all different parts of our islands, and populations in our islands.
So we're gonna have to wrap this up, finish up.
I'm going to say one more thing before, just so you're clear on the surveillance program. I don't know that Dr. Park mentioned this. Politically, we're getting questions about this. This is a statewide survey, and we're actually sampling individuals from all corners of the state. We've actually oversampled Lanai and Molokai just because we wanted to be sure we got data from them. But we are looking at collecting data from the entire state, so that if we do find positives, we'll be able to focus, to some extent at least, on where those are and be able to impose mitigation measures at that point. Hilton reminded me to be clear on these 3 categories of data collection. Again, not to beat a dead horse, we're collecting data through our normal investigation program using our own state laboratory. Those are individuals who are seriously ill, who have been exposed somewhere where there is likely to be a high risk of infection. We have the surveillance program, which is looking at individuals who are not seriously ill, who may not have qualified for testing. That is also being done by our laboratory. And then we have the private labs that are now screening individuals with a threshold that's lower than what we're requiring. People with moderate or lesser symptoms that may be infected, and we're expecting to get a lot of new information from those laboratories. And of course, hopefully in the next week or 2, we'll have some local labs up and running to do those screening tests and be able to report to us.